name is Ariana, and my group will be doing a health promotion video today on fall prevention for adults 65 and older. First, I'm going to start off by stating the school honor code. We have not received, knowingly given, nor tolerated the use of unauthorized aid on this work. So today we'll discuss fall prevention for older adults. Falls are one of the leading causes of injury in adults 65 and older. Many falls are prevented through education and health promotion. What is health promotion? Health promotion is defined as helping an individual improve and maintain their health through education, prevention, and healthy lifestyle choices. Fall prevention matters because falls can cause fractures, head injuries, hospitalization, and loss of independence. Many fall risks can be reduced through simple changes at home and healthy habits. Next, I'm going to show you a couple of unsafe fall preventions, and then after that, I'll show you a few safe fall preventions. So first, we have here a rug. It's a loose rug. Very easily can be tripped on as you're walking because of how easily it moves. And next we have clutter. So anyone, who has animals, sure, you see your toys left around on the floor, which is very easy for someone to trip and fall over. Next, a couple of safe preventions. A gripper. That way you can pick up these toys and move them, or any object on the floor for that matter. But this is a good way for anyone who, can't bend over, have balance issues. Next, I have another unsafe, this ledge. Many people who struggle to get up and down could struggle to get up over this. So a safe way would be installing handrails in your house to help you step up and down off of the ledge.
Hello everyone, my name is Tahtyana. I will be discussing primary and secondary prevention strategies for fall prevention in older adults. Primary prevention focuses on stopping falls before they happen. One of the most effective ways to prevent falls is through regular exercise or physical activity. Exercise such as walking, strength training, balance exercise improves muscle strength, coordination, and stability. Older adults should wear supportive, non-slip shoes or socks and avoid loose slippers or walking in socks that don't have the grips. Another important step is making home environments safe by removing clutter, securing loose rugs, improving lighting, and installing handrails where needed. Secondary prevention focuses on identifying fall risks early before the injury occurs. Healthcare providers can perform fall risk assessments, review medication for side effects such as dizziness, recommend vision and hearing screenings. Older adults should have a regular eye exam and report any balance problems like weakness and episodes of dizziness to their provider. Family members and caregivers can also help by observing for changes in mobility or signs that a person is maybe at risk for falling. You can find side effects on the side of your medication bottle as to what it pertains to. By taking these primary and secondary preventions measures, older adults can reduce their risk of falls and remain independent and maintain a higher quality of life.
Hello everyone, my name is Olivia Adkins. My part of today's presentation focuses on what to do after a fall, how to safely use assistive devices, and ways you and your family can continue preventing falls in the future. If you have experienced a fall, it is important to know that recovery is possible. Working with a physical therapist or participating in rehab can improve your strength, balance, and confidence so that you can safely return to your daily activities. Don't be afraid to ask your healthcare provider for help if you feel unsteady or if you're worried about falling again. If your healthcare provider recommends an assistive device, such as a cane or walker, using it correctly is really important. Make sure your cane or walker is adjusted to the correct height. Your elbows are slightly bent when you're holding the devices. If you use a cane, hold it on your stronger hand and move it forward at the same time as your weaker leg. If you use a walker, move the walker a short distance in front of you, making sure that all 4 legs are placed firmly on the ground, and then step into it before moving it again. You should always wear supportive shoes. Avoid rushing, keeping your head up and looking forward, and never use furniture to steady yourself while walking. It's also important to remember that everyone has different beliefs, traditions, and family values. Some older adults prefer to make healthcare decisions with the help of their family, while others just make decisions independently. Involving your family or caregiver in learning about fall prevention can provide extra support to you and help make your home a safer place. Educational materials should be easy to read and understand, and you should never hesitate to ask if there are any questions that you have over something that is unclear. To conclude, preventing future falls is one of the best ways to protect your health and maintain your independence. Staying active, following your rehab plan, using assistive devices correctly, and asking for help when needed can reduce your risk of another fall. Small changes can make a very big difference in helping you stay safe, healthy, and independent for years to come. Thank you for taking the time about learning fall prevention, and remember, your safety is the key to maintaining your independence and quality of life.